Welcome to our newly rebranded Christian Dementia Caregiving podcast. This is episode 147, and I am really excited to have a very special guest, special in a lot of different ways, but a very special guest who is a geriatrician. And it is doubly special because geriatricians are not very commonly out and about in the medical world. And secondly, Nakeisha is a Christian doctor, which means she's navigating the healthcare system from a Christian worldview, which, having been in the healthcare system, I know can be extremely challenging. So I want to thank you, Nakeisha, for your willingness to be on my newly rebranded podcast and spending this time together today. It is a sweet, sweet blessing.
Thank you.
So why don't you start off and tell us a little bit about yourself and tell us why you got into geriatrics? Because I know that many physicians do not want to be a geriatrician.
I know. Well, first of all, Miss Lizette, thank you so much for having me. I really appreciate this platform that you are using to amplify our voices. So as you stated before, my name is Nakeisha Rodgers. I am from the beautiful islands of the Bahamas originally. My story really begins with, living there and going back and forth. But I've always had an interest in biology. I always loved living things and so forth. So when I was in primary school, I went to a primary school called Our Ladies. I had this really amazing teacher. Her name was Barbara Mosley. She's still, around. And she was just really someone that I always remember because she always made me believe in myself and believe that the sky was the limit from the age of 6. And I still, think about her to this day. And so when I graduated from that school, I went to this high school. They call it the Big Red Machine. So a train is our big logo. But it was called St. Augustine's College. And when I went to St. Augustine's College, I had amazing teachers. I remember like my math teacher. I loved all the subjects, but there was just something about science, really biology, that I really enjoyed doing. And I had this teacher there, wonderful teachers, but this one, her name was Miss Edwards, and she would always call me Miss Rodgers. And I was like, why is this lady calling me Miss Rodgers? But I kind of figured out eventually she realized that I had a knack for biology and I was always asking questions. But I mean, to speed up, there was just something about science. And I always question, why are these things connected the way they are? And about that same time, like around the 9th or 10th grade, I started to really question my faith, as a believer. And I had these 2 religion teachers, and I would just start asking them questions about the Bible and, why is this, why did God say this? And I just had a desire for God's word. And at the time, I mean, being full transparency, I wasn't really going to church a lot. I would have been like 13, 14. So it wasn't my parents were Christians, but they weren't forcing me to go to church, which you shouldn't. But around that 13, 14 age, I started to go around the corner from my home to a church because it was in walking distance. And I go like every Sunday, I'd go to service. I started talking to the pastor and I just had a desire. I didn't really understand my Bible per se, but I would get the baby Bibles and like read the stories of obviously David and Goliath and go through the Old Testament. And then eventually, I just kept going to that church. And that was really, really a big part of my growth as a Christian when I was 13 or 14. And then more and more at that church, we started to really work with the children there. And we were there was another lady, she was a little older than me. And we put together this kids teaching thing. So this after school program for kids there. But I say that to say like that period, like that formative period around the age of 15 all the way to 16 is when I really started to have questions about God and my faith. And I was just more curious. And I realized like God became more definitely like important to me. Like it was, even when I would study, I would pray. If I would get, stuck about something, I would just say, God, help me, help me. And I saw him just come through in amazing ways. And as I graduated, I had this decision to make, like, would I stay in the Bahamas or I leave? But, because I had been having my relationship with Christ, I was just starting to get more direction. And he put people in my life. I mean, honestly, it was always someone. And when I look back at my life, I'm like, yep, that was the person you put to encourage me or guide me. So the decision, that I made after prayer and my parents and so forth was to stay in the Bahamas after we graduated. And I'm glad I did that because I was only 16 and I wasn't ready to go off by myself yet. So
Yeah, that's super young.
I was super young. My husband was like, "You're not going anywhere, right? You're staying here." So I stayed there for 2 years and did an associate's in biology and chemistry. And again, still kept reading my Bible, still kept going to church and so forth. And then the big decision was, okay, what are you going to do now that it is time to, it was 2000 and it was time to make that decision of where I would go. And I remember just definitely being in prayer and talking to different people. But at the end of the day, there was a lady that visited our college in the Bahamas, is now the University of the Bahamas, but she visited at a fair, and there was just something about her spirit that was just so calming and so reassuring. And she was from Nova Scotia, so she came to show about her university. It was called Acadia, and I just
Mhm.
gravitated to the booth, and I started talking to her about what they offered, and of course the magic words biology. She's like, "Yeah, we do biology, chemistry there." So I left the Bahamas in 2000, went to Acadia University. And again, as God would have it, while I went to that university, we had an opportunity to do different things after hours. So, people would go and, do sports and so forth, but you would find me. There was a nursing home that was a
Ah,
little down the way from the university. And I don't know, had to be God, because I was just walking one afternoon, just exploring Nova Scotia. And I was like, this is a beautiful building. And I just went inside, knocked on the door, introduced myself, and I quickly figured out it was a nursing facility. But they were so kind to me. And I still have their pictures. There were these two ladies, and they did the arts and craft. And they said, "Come in, come on in." And so every Friday after classes, I would go and help them with crafts. I'd help the seniors like color, put the crafts out, and so forth. And unbeknownst to me, I was actually seeing the elements of, interdisciplinary care,
mhm,
because I would come in the afternoons and I would see the nurses doing their rounds, giving the medications. I'd see the physical therapist, then
mhm.
I'd see the doctors rounding. And so I didn't have obviously the formative training as a physician, but God was like showing me like little
The
nudges,
little pieces.
little pieces exactly. And I just remembered enjoying, I look forward to Fridays. People were like, "Where are you going? The nursing home?" And I was like, "Yes, the nursing home." And
You were an odd little duck, girl.
very, very much so. But it was so much fun. I remember at one Easter, I took a friend of mine because he was a really good singer. He still is. And we still laugh about this, but I took him and two friends to sing for them for Easter. And we went around to different rooms, and then the arts and craft people let me bring them and sing to the seniors for Easter. But when I look back, I could see God's hand in everything. It was a little bit of this and a little bit of that and all of that. But
Isn't
yeah,
it amazing that when you know what God's providence really is, you
yes,
can look back on your life. You cannot see it right in the moment that you're living it.
the
But
ex-
when you look back, you can say, "Oh, this was for my good and his glory." And I'm gonna
yes,
kind of segue into dementia caregiving related to that because
yeah,
I think a lot of people forget
yes,
God's providence in dementia caregiving, and
yes,
they feel like it might be um, a punishment or they don't necessarily see God's goodness despite dementia. And, that's one of the big things that I'm trying to change for people because when
yeah,
you come, when somebody's through this whole dementia caregiving journey,
yeah,
it's been for their sanctification, and
mm,
you can still see God's providence in
yes,
dementia. And so,
yeah,
I think your story just reminds me so much that God is in the details,
yes,
in all of the details of our life, even
mhm,
though we don't feel it necessarily at that time. But I
yes,
love how you could pull out the pieces and the people who were put in your path,
yes,
specific time and a specific place to get you to be
mhm,
Dr.
yeah.
Nakeisha now.
Definitely, definitely. Yeah, I
But what a
definitely.
culture change going from the Bahamas to Nova Scotia, by the way.
I know. There were days, Miss Lizette, when I would walk home from the cafeteria because it was on a hill. And I mean, in the snow, and I'm like, why am I
Mhm.
here? Why? And why? But eventually I enjoyed it. I really enjoyed it. So it was a really good time in my life.
But I do note you are not living in
No, so enough of the snow. It's good to look at, but it was enough. That was enough.
So after that, tell us a little bit about what you're doing now and how you can incorporate your faith
Oh yeah.
into being a doctor in the medical world. Because I'll use this as an example. I worked in a small hospital in Greenwood, South
Mhm.
Carolina. We live in Greenville now, but I was working in Greenwood. And there
Yeah.
was a Christian physician on staff,
Yeah.
and I loved working with him. And what he would do, in the acute care hospital, is
Yeah.
he would ask his patients if he could pray with them. And
Oh,
that was how he incorporated his faith.
yeah.
Most people didn't say no.
I agree. I would have to agree. So right now I'm in Florida, just a stone's throw away from the Bahamas. But I do the same thing. So I think for me, I think you mentioned that you have a prayer journal. So I keep one as well.
Mhm,
And so when I get up in the morning, I definitely have my time set aside where
mhm,
I read my scriptures and then I go on my journal and I write down. And I'm like, okay, God, this is what my plan is, but help me to be cognizant of your plan throughout my day. And before I even go in the rooms, sometimes, if I before I knock on that door and go in the room, I'm like, okay, God, I need you, give me the wisdom. I agree with what you said about that doctor. I do ask people, is it okay? And 9 times out of 10, I don't think I've ever had anyone say no. Obviously, we don't force it on people, but
right,
you listen to the spirit's prompting, and
mhm,
there sometimes you'll see where somebody's going through something and you've come up with this amazing plan of take this medication, do this, do that, eat this, eat that, but you could see someone's really weighed down. I remember just recently I had someone that came to me. This person just came and said, I lost my son. And, we were just traumatized because she was so excited to come and move here to be with her son. And I think the son died in a car crash. And when she showed up to our clinic, she was just really, you could just see it. And in my spirit, I sensed it like this,
mhm,
she needs someone, everybody was giving condolences. But before she left, I asked the nurses stepped out. So she and I were left in the room. And I just said, I extended my hands and I was like, is it okay if I spend some time praying with you? And she just wept and she
mm,
just wept. And I could feel the load lifted. And the obedience is so important. Like when
mhm,
the spirit tells you to do it, it's really important to be obedient. The worst they could say is no.
right,
But when, I just let her weep. Then I just prayed over her and I said, I pray that God would bless you with his strength and his and letting your family know that he's going to be with you and your family and the grandkids. And she ended up, giving that strength back to me. And she just said, thank you. And it was amazing. But to see God get the glory in that moment,
mm,
that was really, really good. I think that was better than any pill or medicine we could have given her.
absolutely.
Mhm,
Because bottom line is, you're a doctor. We
mhm.
know this. None of us are going to make it out of here alive, right? So talking to her about her specific spiritual need right at that moment was
Yeah,
way more important than her physical need.
exactly,
Yeah,
exactly.
what a blessing that was. Oh, awesome. I wish I had more doctors like you working with me in the hospital. So you mentioned the clinic. Do you work in the
Yes,
hospital or do you
I
mostly work in
do.
the clinic?
I work mostly in the clinic, but there are times when I'm on the floors as well. And
Uh-huh.
there is definitely when you see people really, really receptive to prayer. Because I mean, obviously it's more acute. There are things that they're going through. Sometimes they have no one to visit them. And then there's times when people, they may act out or they may seem frustrated with staff or they may lash out. And if you go in your own flesh, you're willing to lash back. But I mean, what will that accomplish? So it's really important to remember, like, I don't know this person's going through. I'm not in a bed laying here sick and I can't move. So imagine that. So when you go in that room with Lord, just make me a servant, help me to put myself in their shoes. It just kind of it gives them they could feel the love. People can tell. You can't
Oh,
fake.
absolutely. One of the I don't know if you're familiar with Dave Ramsey.
agree with that.
So Dave Ramsey has this saying, when somebody asks you, how are you doing, that you answer better than I deserve. And as a occupational therapist, when I was working with patients, when they
Mhm.
would ask me how I'm doing, I would always, always answer better than I deserve. And what I
Yeah.
found very early on in using that, it was a very easy screening tool for me to see where the person's heart was
Yes.
as to which way the conversations would ultimately go. And what
Yeah.
I found fascinating, this is subjective, it's not data driven, but when when I had good experiences and the person really benefited. I'm not saying unbelievers didn't benefit from what I did and
Yeah.
worked with them on, but there was a different connection with
Yeah.
true believers. And in the home health arena, when I started working in home health, it would
Yeah.
not take me more than 10 minutes of being in somebody's home
Yeah.
to know where their heart is.
Yes, and you could see the evidence. I mean, you could
Oh,
see,
absolutely.
see it in the home and so forth. So, and it just changes the dynamic. I think people receive the treatment better. They trust
Yeah.
you because you have a common ground, you
Yeah,
know.
for sure. For
Hmm.
sure.
Hmm.
So, I know one of the things that you do is you teach.
I
And
do.
I love that. That was one of the biggest things why that's part of the reason I have the platform I'm building is because I can multiply myself
Yes.
by using a larger platform. And that
Hmm.
was why I taught OT students because, I can only see one person at a time. So
Exactly.
my sense is that that's one of the reasons why you teach. Tell
Yeah.
us a little bit about what it is that you're trying to accomplish through uh, investing a lot of time and
Mhm.
effort into upcoming physicians.
Yeah, I think with them, it's you see when they come in so excited and they come in, oh my gosh, I want to go see patients. I want to do that. And the thing is, the system and different things can change you with time. With
Mhm,
time, people can go from that amazing experience to just a number. I've seen it
mhm,
happen. I've seen it
mhm.
happen in colleagues. I've seen burnt out. I've seen it and I get it. So my job is just to keep that excitement for them to realize that this is an honor. This is a privilege. You don't take this for granted. You didn't have to come here, but God made a way for you to be selected to get into a program. And there's thousands of people that don't get selected every March when we do our process.
Mhm.
So I think for me, and they're different fates, of course. So, and they could see, I mean, I don't have to go around preaching, but I
No.
think just showing them how to love on people and just trying to treat everybody with respect. I try to tell them do not get into that system where we marginalize people in our comments. It's easy for them to hear, and I'll just be transparent. Like
Mhm.
sometimes people that have been around longer in the system will make certain comments about certain nationalities
Oh, for
or
sure.
will say, oh, this person is always a bounce back. This person is a frequent flyer. And I'm
A
like,
boomerang patient.
exactly.
You wanna know what
The
mine is?
non-compliant, right?
Non-compliant.
Exactly. And obviously I get it, but if we keep doing that, then we treat people differently for no reason and we don't know people's stories. You don't know what that person has to go through when they leave. They may not have any food. That's why they're coming to the emergency room. So I tell them,
Right.
I try to teach them like this person's coming to you for something, whether that be, medicine, treatment, but you can give them hope and you can do it in a dignified way. And I try to teach them, like, what if that were your mom? Like, if they don't return a phone call for someone's medications, they may think, oh, it was just, I'll do it tomorrow. And I'm like, no, what if that was your mom calling, your 70-year-old mother or your grandmother calling for that blood pressure medication?
Mhm.
And then they like, oh, that's true. I would want my grandmother to get it. So I'm always trying to teach them, like as the Bible says, do to others as you'd want them done to you or your
Mhm.
family members.
So what I really find fascinating about what you just said is you are actually using a lot of the techniques
Yeah.
to communicate with your students
Hmm.
that family caregivers need to effectively communicate with a person with dementia. Because
Yeah.
when people come, and your patients, when somebody's going to the emergency room,
Yes.
it's not always an emergency.
No.
There are, like you said, I'm hungry, I'm cold, this is a safe haven. And
Yes,
teaching those students to look at the bigger picture
exactly.
and how to communicate with another human. Like one of my biggest pet peeves in the dementia caregiving economy system is the words challenging behaviors. And I always use the inverted commas challenging behaviors because that's the medical model. That's what the medical model and society and so on have used to classify. And I understand why,
Mm-hmm.
because we need a word to describe what we're seeing.
Mm-hmm.
But those challenging behaviors are always challenging to whom?
Exactly.
It's challenging to me, the person who's
On the
dealing with the
receiving end.
behavior, right? But in essence, these are just normal human behaviors that are magnified.
I like to think of them as just the unmet needs. There's
Right,
something that they're trying to communicate with you, and it's a
exactly.
need.
And there is a reality that certain of these things that happen are absolutely 100% a direct result of the change in the brain. I
Right.
get that.
Yeah,
Hallucinations is one of those.
definitely.
There's certain things that it's just because of the physical change in the brain.
Mm-hmm.
But for the most part,
Mm-hmm.
it is because I can't let you know what I need anymore.
Yeah. And that's hard. That's
It
hard.
is.
Both sides. Mhm.
There's a movie many, many years ago, and I forgot the name of the movie. Of course, now I'm not going to remember it, but in essence, it happened in France. I don't know if you've ever heard the story. He was an editor to a big magazine, I want to say Vogue,
Okay.
and he was driving with his 14 or 13-year-old son or
Okay.
daughter when
Mm-hmm.
he had a massive stroke. And
Mm-hmm.
the child was able to get the car off of the side of the road, but the
Okay.
gentleman had the type of stroke that caused locked-in syndrome,
Oh gosh. Okay.
and he wrote this book. Oh, it's, The Diving Bell and the Butterfly.
Okay.
You need to
Okay.
go look it up. It's a fascinating book. He wrote a book using eye blinks with a speech language pathologist
Yes.
who came up with a system of frequency of letters.
Yeah.
Not the alphabet, but the frequency of letters. And she would
Okay.
just run through the frequency, and when it was the right letter, he would blink, and letter by letter, they wrote it down.
Wow.
And it's a very powerful book to read,
Mm-hmm.
but he also lost the ability to communicate with people,
Mm-hmm.
and so cognitively, he was 100% intact, but
Yeah.
he had no physical ability to move anymore.
Yeah.
And so the reason for the book, The Diving Bell and the Butterfly, was when the weight of the world was on him, he was in the diving bell. All
Mm-hmm.
of the weight was pushing on him. But then he used his imagination to be
Yeah.
the butterfly
Yeah.
and to leave. So if you haven't ever read the book or watched the movie, it's actually a very powerful, as a healthcare provider, it was a very powerful book to read
Mhm.
because he could tell us what he was feeling. A person with dementia
Yeah,
cannot tell us what they're experiencing.
exactly. That's a really good analogy.
Yeah, it is. It's very, very good. Did you know that caring for a person with dementia doesn't have to be this hard? If you are struggling and you would like to join our next free workshop, the topic of the workshop is 3 tips how to avoid challenging dementia behaviors without stress, anxiety, or burnout. I invite you to walk away with science-backed dementia caregiving skills that many professionals don't even know after attending this free workshop on Saturday. If you'd like to register, message me the word workshop on Instagram or check out the link in the show notes below. So tell people a little bit about how you serve family caregivers? Because you're a super busy woman because you work in a hospital, you take care of training up new doctors, obviously taking care of yourself. But I also know that you work with family caregivers.
Oh,
So
sure.
tell people a little bit about what that looks like.
Sure. So my parents are in their 80s, very sassy still. And so we did a book in 2022 called The Secrets of Sassy, Savvy Seniors. Like, say that really fast. And so based on the way that book turned out, I turned that book into a course. And so that course is an online 5-module course that we do with caregivers. And basically my goal is really to help caregivers get the tools they need to, decide if they need someone like me. And if they don't decide to get a geriatrician, I try to teach families how to spot the right doctor for them. I give you the tools that I use to pick my parents' doctors because
Mhm.
as doctors, there's things that we look for. So I teach them, what to look for to see if you're a good fit. Like, what should your doctor be doing? Then we also, in the second module, go over, once you've selected the right doctor, how to make that visit count. Because, you only have like 20 minutes on a good day, 30 minutes. And so I find the patients and the families who really are prepared and they know what to ask, they know how to really use and maximize that time efficiently. I have one patient, she's so trained right now with the system that, she knows she has her notebook and we have the questions pre-prepped. And that saves the doctor a lot of time and it
Oh, for
allows
sure.
questions to be answered. And then once we go over, pick the right doctor for you, how to maximize the time, then we figure out what is normal aging. Because a lot of people are embarking on careers in dealing with people over 65, but sometimes it goes vice versa. We'll tend to think a symptom is a part of getting older. Or likewise, we'll think that something that is really dangerous is supposed to be happening. And it's like, you have to know the difference. So
Mhm.
we go over like what's normal aging and then what's like, no, mom shouldn't be doing this or my uncle shouldn't be doing that. And then once we've done that, my favorite is everybody's favorite. We love to be in the comfort of our homes. So my parents are like, my father is a homebody, loves to be home. He was just over here for a while because I got to get back to the Bahamas. But our goal is to keep people out of the emergency room. I came down here, I worked in Virginia, and that was a big force of what we did, trying to innovate, think of creative ways. What are we doing that is landing this patient back into the emergency room? So we go over with families the things to look out for, how to spot an emergency, what to do, how to have your plan together, how your doctor and the staff can help you keep that person home in the comfort of their home. Because sometimes a lot of people didn't know, oh, I could have called, I could have done this, I could have done that. When they were traveling, I should have had a plan. So we go over all those different scenarios. And then like I said, I love teaching, I love hearing from people. So the goal is to get through the modules. We do live sessions and we do scenarios as well. So that's what we're doing for caregivers.
That is wonderful. You've mentioned so many things that I want to touch on. I did an interview earlier this year. It was episode 80.
Okay.
And it's called, for people who want to go back and listen, it's called How One Tool Prevented Medication Errors in Dementia Caregiving. Her name is Kimber Westmore, and
Okay.
she started a product called Pill Map. Have
Ah,
you ever heard of it, Nakeisha?
I've heard of it briefly. Could you tell me a little bit more about it?
So what it is, in essence, it's board with bubbles in
Yeah.
that you can close, and you can put the person's pill actually in it.
Oh,
But
yeah.
it's specifically designed for you to be able to take to the doctor, show
Yeah.
that, put them in, like, for a person to know and be able to identify their medication.
Yes.
Also have all of their emergency contacts on. If you go to the ER, you can, instead of
Yeah.
grabbing a bag full of medication, you can grab this one sheet that
Yeah.
has everything on it. It's a really, really good product. I will link you up with Kimber, because I think for sure, it's less than $15 and it can significantly cut back
Takes time. Yeah.
on people's time and effort. When you go to the doctor and you carry a bag full of medication, which is what you're
Mhm.
supposed to do.
Yeah.
You're
Yeah.
supposed to do that, but how many people do that? That would be an opportunity. But I love the mission of trying to keep people out of the emergency room.
Yeah. Yeah. Definitely. Because I tell my students all the time too, like this is a war zone. So I have
Mhm.
them going in there when they go and do those ward rounds. like, listen, our goal is to, obviously most, hospitalizations will be justified, but even once that person is admitted, they know when they work with Dr. Rodgers, yep, she's going to have us. We physically are getting people out of the beds. Because I'm saying we're not waiting to wait. They're like, we could wait for the physical therapist to, no. So they're
Time to get up.
the seniors don't, nope. They go and they open those blinds. We get people up, we're as we're talking to them, we're, helping them get their food, we're feeding them. I'm like, no, that tray, if that tray's there, she won't remember to drink from that tray. So at least while we're doing the rounds, feed her, help her.
Yep.
And so we do these little nuanced things. And the students are like, that's true, Dr. Rodgers. I didn't think about that. I'm like, there's things that we have to think outside of the model to provide the seniors with the care they deserve and need.
You and I would have worked so well together in the hospital.
Oh
I
my
would have
God.
driven you nuts.
Yes.
I would have been the one coming to saying, Dr. Rodgers, this person has this, and this, and this. Doctors like that were always a joy to work with. There are two types of doctors.
Yeah.
Doctors like you who see the world in a different lens and
Yeah.
recognize and see the role of all of the players
Yes.
in the system. You can't do everything.
No, not at all.
And then the doctors that believe that because just based on title and education, they know more than you.
Yeah.
Have never done significantly well with
Second
the
group.
latter. I'll
Mhm.
never forget one day. Doctors used to scare me. They don't anymore. But
Yeah.
one day when I was a young and dumb therapist, they used to scare me. But then when one day I'm like, you know what?
Yeah.
I'm like legitimately, I'm old enough to be your parent. And you just said something really dumb. It would go through, goes through my mind. I had a doctor one day tell me the patient had balance deficits and that's why they're falling. And I looked at the doctor, I'm like, they're falling because they have cognitive deficits. And he's like, but how does that relate? I'm like, he's making stupid decisions and trying to sit down on a chair that's 10 feet away. I'm
Yeah.
like, he had no balance deficits. It wasn't balance, it was cognition. And the doctor never saw it. I'm like, you will one day, but it's
And
okay.
the beauty of it's teamwork, like you said.
Yeah.
And I think one of the things I try to teach the students also is to everybody's valuable. In the clinic, you guys
Mhm.
won't get patients in if you don't learn how the front desk works. You won't have any patients to learn from. So everybody in the team brings something to the table. You're the one that's like the quarterback. So you're going to coordinate everything, but you need all your players helping you.
Right. And ultimately, it is up to the doctor to make that final decision related to a diagnosis.
Yeah.
But if they're not open to hearing from the family or the therapist or
Yeah.
the sibling of the person, if they're not open to hearing that information, they're never going to be a truly effective
I totally
care
agree.
provider for the person who
Definitely.
is living with dementia. So I'm totally curious out of, and this is now professional curiosity,
Oh, yeah.
but in your practice, what cognitive assessments do you use to help diagnose, or at least start to narrow the gap related to dementia and dementia caregiving?
Oh, sure. So, I mean, the simple screen that we'll do is just your basic mini cog. And I have to, a lot of the patients like, yeah, Dr. Rodgers, I know that's coming. So I have to switch it up a little bit. But the first thing I do is always, take a collateral history. So before we do any screens, it's important to talk to the family, look at the time period that we're dealing with. If you're thinking something that's happening, a change in like 8 weeks or less, you're thinking more of like an encephalitis or another
Mhm.
differential. So one of the things I always do is get a timeline, do a proper history. So before we do any screens, the history is key. And we look at different questions, family history. Have you played sports in high school? Were you in any car accidents?
Mhm.
What's your literacy level like? What age did you, finish high school? So those are the basic things we'll do in the history. We also look for risk factors in that history. So, I'm looking for my person that has the uncontrolled diabetes, or we're
Mhm.
looking for, vitamin deficiencies like a B12 and symptoms of that. So the history is where we definitely start off. and also speaking to the family. I can't tell you how many times, a lot of times people with cognitive challenges may be blissfully unaware and they can fool you.
Oh, for sure.
I've had students come back saying, "No, Dr. Rodgers, no, there's no way she's talking to me." I'm like, "Yeah, but
Yeah.
dig deeper, sit in there deeper and speak to the family." And when they call the daughter, "Oh yeah, mom has been doing this for like months. She's been, misplacing those keys, and I had to take the keys from her because the car is scratched up." And so they're like, "Oh my gosh, it's like two different stories." I said, "I
Mhm.
told you."
Yeah.
So
So a quick last couple of questions. Have you ever used the brief cognitive assessment test?
I start off with the basic mini cog. We'll use the slums from
Mhm.
St. Louis University. We'll do that. And then sometimes we have an 88 Alzheimer dementia 8 rating scale, a screening scale that we'll use as well. Once we've done those basic assessments, we'll get our scores. And then we also make sure that we offer a PHQ-9
Okay.
because we
Yep.
want depression to be, masking as that.
Sure.
And then for a lot of my older ones, I'll also use my GDS, my
Mhm.
geriatric depression screen, because I don't want the influence of, physical factors
Sure,
from
sure.
nine. We do the screens for the cognition, we do the screens for the mood and anxiety. And then once we've done those screens, we'll do a battery of basic tests. We'll check people's electrolyte levels, their
Mhm.
vitamin levels, their thyroid
Make
levels.
sure there's nothing physically going on.
Exactly,
Yeah.
exactly. And then we'll do some sort of imaging of the brain, typically
Mhm.
CAT scan or an MRI of the brain at the very
Sure.
least.
Yeah.
Now I tell my kids, they hate when I call them my kids. They're like, "You're adults." I'm like, "You're my kids."
They're your kids. They'll
I
always be
tell
your kids.
Yeah, so I tell them because we've had, I can think of a guy that was an IT engineer and obviously would come through those screens with flying colors. So for someone like that, they get neuropsych testing,
Yeah.
and so they'll come and spend the entire day, and that's a little bit more. We could get more
Intense. Yeah,
information.
yeah, for sure. But
Yeah,
what I really wanted the family caregivers to hear is your thought processes of where to start, because a lot of people will go to their doctor and the doctor will tell them it's normal aging. So what I want family caregivers to hear from our conversation today is if
yeah,
their scientific part of their body, in other words, their gut, is
yeah,
telling them
yeah,
something is wrong, and they
definitely,
need to follow up. And if their physician is not doing it, they need
definitely.
to find another doctor.
Hence the module that I told you, choosing the right
Yes,
doctor for you that listens to
exactly.
that. And then my sister's an amazing advocate. And I find, again, the patients that do well are the patients who are advocates or they have those caregivers. And there's a way to advocate. So
Sure, for sure.
you don't want to ruffle too many feathers and so forth, but there's a way to respectfully voice your opinion. And typically the doctor that's really, like me, I'm excited when, patients bring me or their families bring me information. I'm like, definitely, I didn't consider that. Let me look into that.
Well,
Uh,
bottom line is it cuts down your work, really.
Definitely, definitely. And so when they're involved and they're, bringing things to the forefront that I may have missed, that's a gem. You're looking for family members like that.
Mhm.
That's a gem.
So, Nakeisha, if somebody wanted to actually get your course, because I'm very excited about your course, where do
Mhm.
they go to find that?
Oh yeah. So on any of our social media platforms, LinkedIn, Facebook, Instagram, and so forth, we normally have a barcode.
Okay.
You're able to click on, and it'll take you to the secrets of sassy, savvy caregivers.
Oh, I
Mm.
love it. I'm going to go check it out. And
Definitely.
any last final words before we close off today?
I would just, first of all, I just want to say thank you for what you're doing. I think that a lot of people are going to be blessed by giving a voice to our faith. I think so many times, especially right now in the society we live in, we tend to have to feel like we have to dim our faith or we have to be careful in what we say and so forth. But I think you have to be an ambassador. And if we don't speak up, then other people speak louder than us. So
Mhm.
I think, just given a platform that you're using to let people know that there is a beauty in bringing your faith to the care of dementia, I think is amazing.
Mm.
Thank you for
Well,
having me.
thank you so much. I really, really appreciate your time today, and I look forward to seeing you again in the future.
Yes, definitely. Thank you so much.